I want to speak a little bit about the theories and causes of ADHD. There are a lot of different explanations that are running around. Some are controversial. It's been argued without a lot of scientific evidence, for instance, that ADHD may even be a leftover trait from our evolutionary heritage as hunters and gatherers. Of course, there's this idea that ADHD is caused by too much sugar, too much yeast intake, motion sickness, bad parenting, etc. And then there are others that believe ADHD is largely a myth because perhaps as a society we need this. Excuse me. But let's look at kind of the evidence-based theories that are out there. First, we have to look at genetic factors, and certainly there's no single theory that can explain the differences associated with ADHD, but most evidence treats ADHD as a neurodevelopmental disorder that has both genetic factors and neurobiological factors. So we always look at twin studies, and when one twin has a diagnosis, we like to look at the concordance rate, meaning what's the percentage of cases where the other twin will also have the diagnosis. And when you look at ADHD, it can range anywhere between 50 and 80%. And if you compare that with fraternal twins who only share 50% of their genetics, that drops to about 30%. So we do see higher rates of ADHD among identical twins who share genetics. But also ADHD runs in families. Children are more likely to have a parent with the disorder than children without ADHD. We also have to look at what genes might be involved. Dopamine receptors are pretty prominent in brain regions that are responsible for regulating attention and inhibiting behavior. And people who have lesions in these areas, like scarring, often show ADHD symptoms. And we do know that the medications we use to treat ADHD do often target the dopamine system. So those are the factors in terms of, genetic factors that might be involved. We also know that there may be some prenatal risk factors. So did mom use alcohol and drugs? Was she exposed to toxins when she was pregnant? What about any kind of infection that may have occurred during her pregnancy? And we believe that maternal cigarette and alcohol use are particular risks. For whatever reason, it seems to be stronger for female offspring and for children who carry a specific genetic risk for ADHD. In terms of any neurobiological factors, these are the parts of the brain that actually look different. And we do see some reduced brain volume for several brain structures. We see a smaller than average size of the prefrontal area, parts of the cerebellum that have been associated with ADHD. In fact, some of these areas have been associated with some of those core symptoms of ADHD. Also, various brain scans indicate that young people with ADHD have decreased blood flow, slower brain waves, which again may all indicate underactivity. And then, of course, is the idea of diet, allergies, and lead. So one controversial idea was that foods that contained artificial dyes or preservatives were related to hyperactivity. We don't have a lot of research that supports this claim, nor do we have a lot of research or evidence, indicating that there's a relationship between sugar intake and cognitive or behavioral functioning. So of course, the question is, do special diets help ADHD children? On average, we find the difference is small, and the benefits tend to be reported more by parents than they are teachers or clinicians. What about the cause of lead intake? And this is not an unreasonable theory because lead exposure, of course, has been linked to a number of other, deficits in biological functioning and cognition. So we do see that there's an association of lead exposure in children with ADHD, but again, that is a pretty small relationship. And then the final influence we'll look at are family influences and numerous correlates of children's ADHD, everything from economic disadvantage, stress, conflict in the home, poor mental health, poor coping skills have kind of been associated with this. Overall, there is evidence that ADHD in children can affect parent behaviors. And of course, we know that parent behaviors can in turn affect child behavior. So there is this kind of cyclical interaction that occurs. And it brings us back to the importance of that concept, goodness of fit. What is the match between a child's early temperament and how does the parent attempt to parent based on the child's special needs? So let's say you have an overactive child. If you also have an overstimulating parent, that might be a poor fit. So that's my lecture today on the theories and causes of ADHD.